Bisphosphonates, analogues of pyrophosphates, inhibit bone resorption, prevent osteoporosis. Most effective anti-resorptive drugs. According to potency, they are divided into three generations. First generation etidronate, tilludronate. Second generation pamidronate, alendronate. Third generation risdronate, zoldronate. Second and third generation have amine or nitrous ring substitution in side chain. Bisphosphonates are internalized into osteoclast by endocytosis, resulting in disruption of cytoskeleton and ruffled border of osteoclast, accelerated apoptosis of osteoclasts, reducing their number. Bisphosphonates affect osteoclast precursors by inhibiting their differentiation by suppressing interleukin 6. Interference with malvonate pathway impart anti-tumor action on bony metastasis. Bisphosphonates are poorly absorbed orally, produce gastric irritation, esophagitis, contraindicated in gastroesophageal reflux, peptic ulcer, renal impairment. Uses of bisphosphonates in osteoporosis. Bisphosphonates are effective in preventing and treating post-menopausal osteoporosis in women, age-related osteoporosis, idiopathic, and steroid-induced osteoporosis. Alendronate decreases the risk of vertebral and hip fracture by 47 to 56%. Bisphosphonates are more effective than calcitonin and provide protection for 5 years of continuous use. Bisphosphonates are the first choice drugs for osteoporosis. The half-life of alendronate is 10 years. Therefore, treatment beyond 5 years is considered unnecessary. Second use of bisphosphonates is Paget's disease. Due to the abnormal osteoclast activity, there is disordered bone remodeling, leading to honeycomb-like bone architecture. Bisphosphonates arrest osteolytic lesions, reduce bone pain. Bisphosphonates are more convenient, more effective, and cheaper than calcitonin. Combination of calcitonin and bisphosphonates increases the efficacy. Treatment should not exceed 6 months. Hypercalcemia of malignancy. It is a medical emergency with altered consciousness. The drugs to be given are pamidronate 60 mg to 90 mg IV over 2 to 4 hours or zoldronate 4 mg IV over 15 minutes. These two are the most effective drugs but take 24 to 48 hours for action. So these are supplemented by intramuscular injection of calcitonin 6 to 12 orally for 2 days to achieve rapid action. Oral bisphosphonates are not useful. Corticosteroids also lower plasma calcium but they are slow to act, take 1 to 2 weeks. Osteolytic bone metastasis. Pamidronate or zoldronate arrest osteolytic lesions and reduce bone pain. Now the individual drugs. Etidronate, initially used for Paget's disease and hypercalcemia, but it produces osteomalacia, so not preferred now. Pamidronate, used in Paget's disease, hypercalcemia of malignancy, bony metastasis. Adverse effects are thrombophlebitis of injected vein, fever, leukopenia. Alendronate, effective orally, used in treatment of osteoporosis and Paget's disease. Taken orally, empty stomach, with full glass of water. Patient should not lie down or take food for 30 minutes to prevent contact of drug with esophageal mucosa resulting in esophagitis. Calcium, iron, antacids, tea, coffee, fruit juice interfere absorption. NSAIDs accentuate gastric irritation caused by alendronate. Adverse effects: gastric erosion, body ache, flatulence. Oral bioavailability is 1%, 50% is sequestrated in bone, rest is excreted by kidney. Half-life is 10.5 years. Risdronate, used in treatment of osteoporosis and Paget's disease, more potent than alendronate. Equally efficacious, other features same as alendronate. Zoldronate, indicated for Paget's disease, hypercalcemia, bony metastasis. Drug of choice for hypercalcemia. Adverse effects: flu-like symptoms due to cytokine release, nausea, vomiting, body ache, renal toxicity. Osteonecrosis of jaw, but it's rare. Used in osteoporosis in post-menopausal women who do not tolerate oral alendronate or risdronate.